Did you know that depending on your state and provided you meet the requirements, you can participate in a life-ending procedure called physician-assisted suicide? This is not to be confused with euthanasia. They are two different procedures, and I will explain their differences later. Is it wrong? Is it right? I leave the answer to those questions to you because I am here to discuss only the facts. What is physician-assisted suicide? This applies to an adult, meaning over the age of 18, who is a resident of the area and who is considered terminally ill with 6 months or less to live. Gale Opposing Viewpoints database describes this procedure as when a physician provides a patient with the means of ending his or her life, usually a prescription for a fatal dose of drugs. The patient takes the drugs independently of the doctor. So with physician-assisted suicide, the patient is the one who administers the drugs, not the physician. Credo database explains that euthanasia comes from the Greek words eu, which means good, and thanatos, which means death. Credo database also states that in euthanasia, someone other than the patient sets the procedure in motion. The difference in physician-assisted suicide and euthanasia lies in who performs the act of giving the fatal dose to the patient. In the United States, there are 5 states that have authorized assisted suicide. There are 23 states that have had a bill introduced so that a decision can be made, leaving a remainder of 22 states with no legislation or bills in attempt to legalize this procedure. Oregon was first in 1994 with their Death with Dignity Act. In 2008, Washington followed suit with their Initiative 1000. And the United States is not the only place that has legalized this modus operandi. The Netherlands, Belgium, Canada, Germany, and Switzerland are some other places across the world who permit this practice. The process is not as simple as being diagnosed with less than 6 months to live and then asking your doctor to assist you in dying. Sentinel Plus database offers an article titled Physician-Assisted Suicide: Ongoing Challenges for Pharmacists. Within this article, the author explains how detailed this process is. Of course, as mentioned before, the patient must be 18 years old, a resident of the area, diagnosed to die within 6 months or less, but also must be capable of making healthcare decisions. Once these conditions are met, the patient must verbally ask their doctor for lethal doses of medication on 2 separate occasions, no less than 15 days apart. They also must provide the doctor with a written request signed in front of 2 witnesses. Then the diagnosis and mental health of the patient are confirmed by outside physicians. The physician also has to explain to the patient their other options, including hospice care and pain management. The doctor must very clearly give the patient a chance to revoke their request. If the patient wishes to continue, then the pharmacist must be notified in advance of the fatal dose to be given to the patient. The physician then must deliver the prescription personally or have it mailed to the pharmacist. The drugs typically used for this process are either secobarbital or pentobarbital. There is much debate on the subject of physician-assisted suicide. Some people believe that if physician-assisted suicide becomes a cheaper option than seeking life-supporting health care options, then they will choose to end their life instead of choosing life. There is also concern about misuse and abuse of this procedure, since the patient takes the drugs home and no one is there to watch to make sure the drugs are taken and not given to someone else or used for other purposes. I have found that even where physician-assisted suicide is allowed, it's hard to find a doctor willing to perform this process. A lot of doctors believe that this process conflicts with their Hippocratic oath. They feel it is their job to save lives, not to end them. People on the opposite side believe that because they have a say on whether to pull the plug when they are on life support, this is not that different. Losing autonomy, losing the ability to take part in things that make life enjoyable, loss of dignity, and loss of bodily functions are the top 4 concerns of patients seeking physician-assisted suicide. Dr. James Downer is a palliative and critical care doctor at Toronto General Hospital. He believes that while they can treat some symptoms of the terminally ill, such as pain, They cannot treat all symptoms of the dying process. In his experience, most patients seeking assisted suicide are concerned about the loss of independence and control, something doctors cannot treat. While physician assisted suicide is a controversial issue, it is not one that is forced on anyone. Doctors don't have to do it, and patients don't have to choose it. But if patients have a choice in their medical care, does it follow that they should have a choice in dying? Thank you.